How much does a resident make in 2026? Well, probably not as much as you'd think. But first, before we get into the numbers, let's talk about what does a resident actually do. A medical resident is a physician who graduated medical school and they're now working full-time in clinical training. They're licensed physicians, but they're still supervised. Most of them often work 80 hours a week, sometimes pulling 24-hour work shifts, or sometimes 28. Residents write orders, admit patients, do procedures, respond to emergencies. Pretty much anything a physician could do, a resident is actively doing. And here's the part that most people don't realize unless you work in medicine. Residents are paid a salary. They're not paid hourly. So there's no overtime, no extra pay for nights, no extra pay for weekends. And on average, most residents only get about 3 weeks of paid time off. In 2026, most residents in the US will make somewhere between $60,000 and $75,000 per year, depending on their program, year of training, and their location. But when you break that down, for most of these residents that are working 80 plus hours a week, they're only earning $15 to maybe $20 per hour worked. And these are for residents who are often replacing APPs, like NPs or PAs, that are making 2 to 3 times their wage. So, what do you think? Are residents underpaid?